and it's been honor for me to welcome you here in my platform, Anubhavi's World. Am I audible?
Yes, Bhairavi.
Okay. I'm Bhairavi Tamuli. I'm a teacher by profession, and I'm running this YouTube channel, Anubhavi's World, which is working on all-round development of children and women. And though we basically provide videos on education, but still we are trying to focus or share all the sides like parenting, mental health, motivation, etc. And today we are very pleased that we are getting this opportunity to having you here, madam, and focus on physical health also. So at the top of this show, I would like to thank Bimal Bora from Max Healthcare for associating with us and providing us this opportunity. And thank you so much, Kanika ma'am, for being here. And I would like to call my co-host from Biswanath Sariali. Pratiksha, are you there?
Yes, I'm here. Hello.
Okay, I would like to call Pratiksha to introduce ma'am in front of everyone. So, Pratiksha, it's over to you.
Okay, so am I audible to you?
Yeah.
Hello, everybody. So first of all, I feel myself glad to be a part of this webinar. And even more than that, I feel myself really privileged to be here among you with ma'am. So I feel myself really lucky enough to be here and to be able to introduce to you all Dr. Kanika Batra Modi. Welcome, madam, to this platform.
Thank you so much.
You're welcome, ma'am. Kanika ma'am is renowned among us. She is practicing as doctor, a specialist in gynecologic oncogeny. I think she's a renowned face among you all, I'm sure. So what to say about ma'am? She has pursued her MBBS degree from the prestigious Maulana Azad Medical College. She has done her PG from Saidarjung Hospital and VMMC in 2011. Madam remained a senior resident in Rajiv Gandhi Cancer Institute and Research Center. She remained a fellowship IGCS in Royal Hospital for Women, Sydney in 2016. Besides that, she worked in fellowship Gynae Oncology, RGCIRC, in ex-visiting physician in Mayo Clinic. She remained a fellow IARC in IFCPC. Also, colposcopy and pre-invasive cervical lesions training in Royal Hospital, Sydney. She remained a fellow ESGO in KEM Hospital, Germany. Welcome, ma'am. Besides that, ma'am is associated with many organizations. She is really an active member of many renowned organizations like AGOI, IGCS, ASCO, ASGO, HOGD, and FOGS. So mainly I'd like to say that ma'am is associated with cancer care or oncology. Her specialty interest lies in gynecologic oncology and surgical oncology. And today, we are really privileged enough to have such a renowned speaker among us in our team. Once again, welcome, madam. And over to you.
Thank you so much, Pratiksha, for the kind and long introduction that you did. So I'll be talking about cancer awareness. Very good evening to everyone. So 2 questions for you. What is cancer? Certain things that we will be talking about. Why should we talk about cancer at all? What is cancer? What are the common types of cancer? And what causes cancer? What are the symptoms of cancer? Is it preventable, treatable? Fact or fiction? Why should we talk about cancer? Cancer is definitely a big health problem. It is one of the biggest killers. and why is it considered deadly? So cancer cases are rising by over 300% in 1 year. Unfortunately, it will affect somebody we would know very soon. Kind of incidences that are increasing, 1 in 5 men and 1 in 6 women. So these are the latest, WHO releases in which the global cancer data, the burden rises to 18.1 million new cases and 9.6 million cancer deaths in 2018. Various number of cases have been reported from within the country, and it's different incidents of different kind of cancers. So what is cancer essentially? It is the loss of normal cell division. So normally cell divides like this, one cell dividing into the other. In case there is no repair of the damage, then cell division becomes uncontrolled, and these are the mutations that happen. And then this uncontrolled growth is what is called cancer. It can affect all parts of the body from top to bottom. So what are the common type of cancers? We'll specifically be talking about the ones in women. One of the most common cancers in women is breast, followed by cervical cancer, followed by ovarian cancer, then other kinds of colorectal and lip and oral cavity and other cancers. So what causes cancer? Some of the known causes that we can think of are, tobacco, alcohol, cell phones, tight clothing, pollution, obesity. No, not all of them. Cell phones do not cause cancer. Tight clothing does not cause cancer, but obesity definitely does, tobacco does, and alcohol does. So there are these various models of carcinogenesis, which is basically how cancer develops. So certain risk factors that we can modify could be, cigarette smoking. We know that if we stop cigarette smoking, the incidence will reduce. Obesity, excess of weight, if we shed that off, our incidence of our risk of developing cancer will reduce. Alcohol, similarly for UV rays, we Indians are a lot protected thanks to the dark skin that we have. So poor diet that is there. Then some infections, like HIV and hepatitis, they can cause cancers. And physical inactivity, similar to excess body weight. So we know, smoking can cause one of the 14 types of cancers, as we can see, from mouth and upper throat right till the bladder. There are many cancers that it can cause. Alcohol, similarly, mouth and upper throat to bowel, breast, esophagus, a lot of cancers it can cause. Obesity, we know it can cause a lot of cancers, right? From brain meningiomas to esophagus to breast cancer to ovarian cancer, womb cancer, it can cause. So what are the symptoms of cancer? How will we come to know? Any change in the bowel or bladder habits, any sore that does not heal, any unusual bleeding or discharge that is there, any thickening or lump in a breast, difficulty in digestion or difficulty in swallowing, any obvious change in a wart or mole, some nagging kind of a cough or hoarseness. So any of these symptoms, in case they are present, you need to see a doctor. It doesn't mean you necessarily have cancer, but you need to get yourself checked. Symptoms of breast cancer. So any dimpling or depressed skin, if it is visible, any visible lump, any nipple change or inversion, any color change, any texture change, any bloody discharge, all of these are symptoms of breast cancer. Symptoms of oral cancer, any ulcer which does not heal within 3 weeks, any patch that remains in your mouth, any lumps, any swellings if you feel around your throat. You need to get yourself checked. So any lump or swelling all throughout in your body, you need to check, and not just your breast. Then any cough that is there, which causes a change in your voice or a shortness of breath, any of these things. Then any, bleeding that is not normal, whether you're coughing up the bleeding, or there is bleeding in the urine, or there is bleeding while passing motion, or any vaginal bleeding, any bleeding after having sex or after menopause, any sore that does not heal, any mole is anything that is increasing in shape or changing its color, you need to watch out for it. Is cancer treatable? Yes, cancer is pretty much treatable. So initially, if we look at this graph from 1971 to 72, only 25% people would survive. Now, as the time is increasing, now we have in fact more than 50% people who can survive. So the cancer survival has doubled since the 1970s. So if somebody has stage 0 or 1 cancer, it's almost 100% survival. Obviously, as the stage increases, your treatable chances decrease. So it has to be like a dream model that cancer patients are seen by not just surgeons, medical oncologists, scientists, radiation oncologists. There are special nurses, clinical psychologists, medical social workers, then physiotherapy, occupational therapy, dietitians. Everybody needs to be a part of this multidisciplinary team. So what all options we have these days available? It could be hormone therapy, surgery, bone marrow transplant, chemotherapy, target therapy, radiation therapy, and immunotherapy, depending upon what kind of patient we have, what stage it has, what biology of the tumor is. A lot of options are available. So now comes the most important part of this discussion: how to prevent cancer, ways to reduce your risk. As we just spoke about it, we need to stay away from tobacco. We need to make our homes smoke free. We need to enjoy a healthy diet. Breastfeeding reduces the mother's risk of cancer. Vaccinate your children and yourself against hepatitis B and human papilloma virus. Then, sun protection is not really needed so much in India because we have melanin. Then you reduce indoor and outdoor air pollution, be physically active, limit your alcohol intake, take part in organized cancer screening programs. So this is typically, what a healthy weight plan really looks like. You need to include whole grain foods like, these things, and you need to cut down on processed and red meat. You need to cut down on high calorie foods and sugary drinks, and include more of veggies and whole legumes and whole grains in your meal. So why do you need to exercise? It reduces your chances of esophageal cancer, liver cancer, lung cancer, kidney cancer, endometrial cancer, myelomas, bladder cancer, and so on and so forth. So lots of benefit of exercising and being at an optimal weight. So is cancer contagious? If somebody is positive for cancer and they go and touch somebody, is it contagious? No, it is not. Sorry. So what to do if somebody close to me gets diagnosed with cancer? Well, obviously get them treated, and don't treat them like untouchables. Cancer is not contagious. So if you are symptomatic, you need to get tested. If you have a strong family history, you need to get tested, definitely. So if none of them is there, then you either consult a specialist or do a breast self-examination or a mammogram and pap smear for women, and a low dose CT scan for smokers now. So this is what constitutes a self-breast examination, in which you firstly stand in front of the mirror and just see if both the breasts are looking normal. Then you put your hands on the side, and then you see in case any abnormality is seen. Then you put your hands above your head and see. Similarly, all these things you need to feel also. Apart from seeing and standing in front of the mirror, you need to see it also. All these are very easily available, how to do a good self-breast examination, and every woman should do it once a month. Especially, palpation of the breast tissue under a shower is very, very easy and should be done. So now, can cancer be prevented? So cervical cancer is one cancer for which vaccines are available. Cervical cancer is basically the cancer of the lower part of the uterus, which is called the cervix, and it can be basically prevented because it is usually caused by the HPV virus. And this HPV virus, once it goes and remains in the cervix, it can harbor to produce cervical cancer. So these vaccines are typically given to young girls starting from the age of 11 and can be given to women before they are sexually active. They are best used before a woman is sexually active. So Cervarix is one vaccine that is commonly used. So the take-home messages from this talk: no tobacco, alcohol to be minimized, daily exercise and a healthy lifestyle. And do not ignore any of the unexplained symptoms. Be aware and spread this awareness that you have just learned. Some myths that are there, that it occurs only in the elderly. No, it can occur in young also. Only if you have family history, no. There is no pain, no cancer, not at all. Most of the cancers are painless. Superfoods prevent cancer, not necessarily. Biopsy spreads cancer, not at all. It is the first step towards treatment to get a biopsy. Cancer is a death sentence, not at all. Every lump is not a cancer, and cancer is not contagious. Thank you. Thank you so much, everyone.
Thank you, ma'am. Gauravi.
Thank you so much, ma'am. Before going to question answer session, I would like to hand over the mic to Bimal Bora to say something about Max Healthcare, as everyone is new to this concept and even we don't know about it properly. So please say a few lines about Max Healthcare and how you work.
Yes, thank you, Gauravi. So, Max Healthcare, it's a Delhi-based organization. In Delhi and NCR, we do have 15 hospitals, and one more hospital we do have in group. It is in Nanavati Hospital. It is in Mumbai. So total 16 hospitals, and we have total 38 facilities. If we talk about cancer, since this program is mainly based on cancer-based, so we have total number of doctors in cancer. It's more than 100 doctors, around 150 doctors. Out of this, these doctors are segregated in different departments. For gynecology separate, then for breast cancer, then again for GI, you can say for abdominal things. And ma'am is heading mainly this gynec oncology department, this segment. So whenever we talk about gynec cancer, then Dr. Kanika Patramodi is coming in picture to us, and she is point of contact for us. And in this region, actually, we have not introduced Kanika Batra so much because priorly Dr. Aditi, one more doctor is there. She was visiting, but we are planning that if she can come in between also sometimes. And now we are growing rapidly in this region as well, especially in onco departments and parallelly cardiology and other departments. And thank you. So, Bhairavi, one more information I'd like to add here. You might be knowing Ms. Jayantimala Chakraborty, one of retired professor. She is among us. She is a cancer survivor. Ma'am, am I audible to you as well? Jayantimala ma'am. Ma'am, it might be you are in mute. Please unmute yourself. Ma'am, you are not audible. Ma'am, please unmute yourself.
Okay.
Yes,
Can
yes,
you hear?
yeah, right. Ma'am, we are so much pleased to get you here.
Yeah.
So, Bhairavi, with your permission, may I request Madam for 1 or 2 minutes to share your experience as a cancer survivor?
Yeah, sure. Most welcome,
Ma'am,
ma'am.
please.
I had my first cancer in 2004, and it was in my right breast, and I was treated in Madras. It was that time. It was Madras, not Chennai, and I got my right breast removed, and I got only hormone treatment and no chemo or radiation. I lived quite happily up to 13 and a half years. That is, in 2017, I got another tumor in the left breast, a small tumor which I detected myself. And then I pestered one of my known oncosurgeons to remove the tumor. And now it is 4 years. I'm fine. I have completed now 17 years, right from 2004. Can't say when, anything may come up anytime. So I'm ready for whatever comes. Thank you.
Thank you. Thank you, ma'am, for these motivational words. Bhairavi, over to you. You are in mute, Bhairavi.
Actually, we have lost our mother-in-law due to breast cancer. So, means lots of the time we are scared about it. So, Kanika ma'am, first question is from my side. Am I audible?
Yes.
Hello. Ma'am, in most of the C-section cases, the breastfeeding is means a little bit complicated. In my case also, my milk not produced at the time of my baby's birth. And in this whole process of breastfeeding, we just take one breast milk only. Is there any problem or any means probabilities to face such problem in my life?
No, so see, those are preventive things if you are able to do breastfeeding properly. But you have to have screening otherwise also. After the age of 40 years, you need to get a mammogram done. You know, every woman needs to do self-breast examination, clinical breast examination, and mammograms. That is very important.
Okay, ma'am, thank you. And anybody is here with any questions or queries from ma'am? Hello, anybody is there? Any question? Ma'am, one of my friend, actually, she is not seen here. She has asked me one question that sometimes her breast milk, she has one child of 7 to 8 years, and her means her breast secret milk sometimes. Milk like means is there any means way to, or she had to worry or what?
Yeah, she needs to show to a doctor because there could be other hormonal imbalances, increased prolactin, which can lead to that rather than cancer. She needs to see a doctor for it.
Okay, thank you. Anyone there? Bimalda?
Yes, some questions are coming. In my WhatsApp, one question is coming from one of my friend actually. You can ask yourself also as well. Okay, I'm asking on behalf of you. So he is asking like, is there any clothes restriction, innerwear or something restrictions are there due to color or something is there while we're talking about breast cancer?
Sorry, I didn't get the question.
Okay, and the question is like, is there anything related to innerwear or inner garments in terms of breast cancer? Is there anything
What in terms of breast cancer?
Ma'am, I repeat the question. That says asking, is there any restriction or type of bra or any innerwear related thing or color? Any limitations are there for breast cancer formation? Anything is there?
No. There is no such limitation. Nothing.
Okay. Okay. We have very less questions. No problem. So Bhairavi.
Yeah, maybe lots of people has asked me to join, but maybe due to network issues or something others, I have seen only 25 people here now. And so is there any question?
No worries. We'll probably do some other time. Thank you all for your time.
Okay,
Right.
thank you so much, ma'am.
If you get some questions or something later on also, I'm always
Yeah,
reachable for you.
you can mail it to me. No worries.
Right, ma'am.
Oh,
Yes.
Mail ID.
Okay, okay,
Chat.
okay. Then we will get the mail ID of ma'am from you.
I'm writing it in
Yes,
the
sure.
chat box.
Okay, okay, sure, ma'am, sure, ma'am. Thank you.
Thank you. Bye.
Okay, okay, thank you, ma'am, for your precious time.